I invite Dr. Chandrakumar Deshmukh to do the demo with the patients. Your patients are waiting for you. You are a celebrity today, so we'll invite them, do the demo, then we'll start with the Q&A.
We are going to perform live Videocon and Agni Karma, and there are some patients. We will ask them what kind of treatment they want, what kind of disease they have, and we will decide the sthana nishchita of Videocon and Agni Karma, and we will perform the Videocon and Agni Karma. Just we had a session about Videocon and Agni Karma, use of Videocon in different types of disorders, use of Videocon in eye-related disorders just like myopia. So just one Videocon video I showed there about the patala. So sthana, if we can show on a camera, then you can switch, so all people can see. In Sushruta mentioned in the Drushti Vikara, if patient's vision is impaired by any disease, any disorder, any condition, it is called as timira. And timira has different types. There is a prathama patalagata dosha, dvitiya patalagata dosha, tritiya patalagata dosha, and chaturtha patalagata. All timira are sadhya vyadhi. It means vision impairment, all can be cured with the help of Ayurveda. So, how to diagnose a patient with the help of Ayurveda? Because we are going to perform Ayurvedic Chikitsa, that is Videocon, so we must diagnose the patient according to the Ayurvedic text. So, whenever patients comes with the complaint of loss of vision or diminished vision, he may come directly or from the reference of the other doctors. So first of all, we remove the specs and ask every patient, what you see? If patient says that avyaktani rupani pashyanti, there is a not clear picture, that is a prathama patalagat dosh. Suchi pasham na pashyati means, suchi pasham means sui mein dhaga dalte hai na, suchi pasham na pashyati, he is unable to see the whole of that needle, then it is a prathama patalagat dosh. If a person is sitting in front of the patient and patient is seeing the patient, but he is not unable to differentiate between the eyes, nose, and he is unable to pinpoint the eyes, then it is a dvitiya patalagata dosha. If patient is saying that the person is nearer but person is far away, that duram api samipam pashyati. If above things are lower, perception is like mirror, then the dosh is in the tritiya patalagat. So we identify that, and after that we decide the sthana of dosha. So in prathama patalagat we do Videocon on bhrumadhya and bhrupuchha. This is a bhrumadhya and bhrupuchha. This is a pratham patalagat. If patient has a dosh in dvitiya patalagat, then a bhrupuchha, apang sandhi uparishtat do anguli and bhrupuchha, that is a dvitiya patalagat. If doshas are in third patal, that is patient is unable to see properly, foggy vision and diplopia, myopia, metropia, then we go for a tritiya patalagat Videocon, that is a bhrumadhya, apang sandhi uparishtat do angule, bhrupuchha and upanasika. So we usually carried out this Videocon technique thrice a week and for 3 to 4 months for Tritiya Patalagata dosha, and we see the differences using the Snellen chart. Standard operating procedure, this is a Shalya Chikitsa, so every time take the consent of the patient, written consent, there must be a written consent, and after that you go for the procedure. Explain the patient what is you are going to do on the patient, that is a Videocon. So explain how Videocon works and what are the benefit and disadvantage of the Videocon. If the patient is bhiru, then don't do Videocon. Ashwasan karo pahle, and after that you go for Videocon. And before doing Videocon, just clean the surface, decide the site of Videocon, where you want to do Videocon, and then take a fresh needle and Ardhavrihi Vedan Karma at Astigat Bhav. That is a 6 mm needle. You can see here. Then Ardhavrihi Apak Sandhi Uparishthata 2 angule. Then Bhrupucha, because patient is suffering from Tritiya Patal Ghosh. So while pricking needle, there is a cracking sound. That is a cracking sound. So patient feels that while we are inserting a needle, patient feels that it is a cracking sound. That is a rukshata, patalagata rukshata. We can identify that. There also cracking sound, and after that we can see the differences on the Snellen chart. Every time there is no oozing of blood, there may be or may not be. So I just explained there how to do on the Patalagat Vyadhi. This first setting of Vidya Karma is completed.
How many days you need to do?
How many days? So weekly 3, minimum 3 days, per week 3 days, and you can do Vidya Karma for 4 weeks. And after that you see the changes. So if there is a Snellen chart, you can see the difference per Vidya Karma setting, it gets reduced and vision gets improved. So it is a Ardha Chikitsa, it is not a complete Chikitsa, it is Ardha Chikitsa. So you start हेतु विपरीत चिकित्सा, आपको हेतु बंद करने अभिसंधि भोजानी द्रव स्निग्ध गुरुनीच. You ask patient to stop all this type of kind of food which is a drushti hanikarak, and you can also prescribe some medications. There was one slide regarding jivha vikara, jivha roge, jivha mule vedhet. So sir is complaining about the stomatitis. There is a burning sensation on the tongue. So it is a instant result giving treatment you can perform, and you can apply some local growth also. So jivha roge, jivha mule vedhet. ऊपर करो, फिर से ऊपर करो. Simple. Jivha roge, jivha mule vedhet. For stomatitis, you just need 1 or 2 settings. It is painful?
No.
No.
It's not a pain.
Thank you.
It's no, whether you prick or not, I don't know. It's no pain at all.
Yes.
Thank you.
Thank you. Padadari. Just we had a first slide regarding the Kshipra Marma. Angushte Angule Madhe Kshipram Nama Tatra Vidyasya Akshipakan Marnam Cha. So Vidya Karma Sthani Kshipra Marma Se Uparishta 2 angule. So Padadari, Vicharchika, Padharsha, Prabhutishu. यानी संसर व्यास वेद स्वाप साद रुक्तो दभेदनम संगागमंग संकोच वर्त हर्षण तर्शनम कंप पारुष शोषिर शोष स्पंदनम वेष्टनम. This is a different types of pain. Everything comes under the pain, but in the permutation and combination, it is the sansara vyasa veda swapa sadrukto the. There are different types of pain in Ayurveda. So patient is suffering from a padadari. So there is a virechan or raktagata ushnata chikitsa. It is also one condition in Ayurveda explained as pitta, raktagata pitta chikitsa. We can also perform here. Or ashayapakarsha gati. In Charak Samhita, there is a ashayapakarsha gati. So there is a cracking of the heels, but it is due to the pitta in some cases. But in some cases, it is not due to the pitta, it is due to the vata dosha. So in vata pitta samprapti, in both of the cases, there is a vidya karma at the place of kshipra marma uparishta 2 angule. So it is a very simple vidhan karma, so we can perform easily. So this patient will get result within a span of a week with help of some medicines. This is his leg and the place of क्षिप्रम मर्म. पाद से अंगुष्ठ अंगुले मध्य क्षिप्रम नाम. तो यहाँ पे तो हम वेदन कर्म नहीं करेंगे. दिस इज नॉट द प्लेस ऑफ विद्य कर्म. क्षिप्रम मर्म से उपरिष्टा 2 अंगुले, तो यहाँ पे वेदन कर्म करना है. whenever you are going to do vidya karma in such cases, just put your finger on the lower surface of his leg and then find the just angushtayo angule madhya place, and after palpating you will find the place, then just flex the both the fingers and then you go for vidya karma chikitsa at that place. Yes. Ardhavrihi Vedan Karma, that is Ardhavrihi. I just showed in videos, this is the Angushta Mule, This is a Kshipra Marma se uparishta 2 angule. Just put one finger below and just palpate the Kshipra Marma. Kshipra Marma se uparishta 2 angule. Thank you. Any pain? ये होने के बाद मिलेंगे, ये झाल्यानंतर भेटो. पेशेंट बोल रहे हैं कि अंदर पेन है. तो यहाँ पे जैसे हमने देखा था, वी जस्ट सॉ दैट अंशयो अंतरे हम विद्ध कर्म और अग्निकर्म करते हैं. अग्निकर्म करते समय हमने देखा था, वाइल डूइंग अग्निकर्म देर इज अ स्थाना. इफ यू वांट टू डू अग्निकर्म ऑन त्वक, देन गोदंत अजाशकृत गोदंत शराशलाका त्वक गताना. इफ यू वांट टू डू अग्निकर्म ऑन मांस, तो क्षौद्र तैल गुड़ स्नेहा संधि अस्ते गतानाम एंड इतर लोहा मांस गतानाम. यानी लोह धातु जो है, व्हाट इज लोह? सुवर्ण रजत ताम्र नागवंग. सो दैट इज अग्निकर्म ऑन मांस स्रोतस, मांस मसल. एंड इफ यू वांट टू डू अग्निकर्म ऑन शोल्डर, देन यू गो फॉर क्षौद्र तैल गुड़ स्नेहा संधि अस्ति गतानाम. तो हमारे पास यहाँ पे गुड़ होगा, या किसी के पास चॉकलेट है, खिसे में चॉकलेट है छोटा सा, तो चॉकलेट हमें दीजिएगा, हम चॉकलेट से अग्निकर्म यहाँ पे कर सकते हैं. शी इज हैविंग पेन वाइल abduction. You can see her face. Okay. तो सिंपल विद्या कर्म हमने देखा था. इफ पेशेंट इज फीलिंग रेडिएटिंग पेन, वी डू विद्या कर्म चतुर अंगुली ऊपरी अधोवा. तो दिस इज द फर्स्ट वेदन कर्म. If patient has a history of trauma, weight lifting, then we go for Kshipra Marma se uparishta 2 anguli. This is the Kshipra Marma of Hasta, and 2 anguli upari, that is the site of Vedhan Karma. And Ansayoho Antare, third slide was about the trapezius muscles. So trapezius muscles Vedhan Karma 3, and then Vedhan Karma of shoulder joint, because Samprapti is regarding this. So whenever you are going to do Vidya karma, it is a anushastra karma. So consent you must take the written consent of every patient, explain the patient what you are going to do. So there is another Vidya karma in the shoulder joint. So I will not open the shoulder joint due to she is on camera. So I will do Vidya karma from above. Just I need one cotton spirit. This is Ansayo Antare. If you abduct your shoulder joint, then you will get the place of Ansayo Antare. There is a small depression. And in the shoulder, okay, and ask her to lift. पीछे भी जा रहा है, अभी सर्वाइकल को करें. So we will just check the movement while keeping the hand. ये ठीक लग रहा है कुछ? चलो इधर भी है. After first Vidya karma, demand increases. Patient says do here also. कालू ऊपर मोकाल काल चाहिए. Her face says the difference. Trapezius muscle, first layer muscle. There are 3 types of Vedhan karma here according to the layer of the muscle. So we are also doing on the knee joint pain. पूरा पेन है. Oh, we will do Vidya karma at knee joint. She is explaining that she has a radiating pain. Also knee joint arthritis, that is simple osteoarthritis of knee joint. Vidya karma needle. So this is a patella. This is a gross layman language surface marking. This is a infrapatellar bursa lateral. This is a medial infrapatellar bursa. If I place my thumb here and we flex and extend, we will find the exact place of articulation joint. She is saying that there is a pain inside. There also articulation joint we can feel after placing our hand. Kshipramarmasya prishtadho angule. You can see the fresh blood coming. Shota Vedhan Karma. Knee joints adhopari chaturangule va. That is related to the radiating pain. And medial infrapatellar bursa, lateral infrapatellar bursa, and medial articulation joint. These are simple Vedhan Karma in simple osteoarthritis. Every time when you go for Vidya Karma on knee joint, the semi flexion and semi extension, that is the position of the knee joint.
கொஞ்சம் நல்லா இப்படி கை பிடிச்சி இப்படிங்கும்போது உள்ள இந்த இடம்
बैक को भी करेंगे.
கொஞ்சம் பின்னாடி போகணும்.
वॉक एंड इनको चलने को बोलो. हाँ चलने को बोलो. After Vidya Karma, there is a sequence of Shulagna Chikitsa, that is a Snehana, Svedana, Bandhana, Mardana, Vidya, Agni. So we did Vidya Karma. After that we can also go for Agni Karma also. उसको सीढ़ियाँ उतरने को भी बोलो, अच्छा लगेगा.
எனக்கு இந்த ஊசி குத்துனதுக்கு அப்புறம் பரவாயில்ல, நல்லா இருக்கு. எனக்கு இந்த வர்மாசி இதை மைக்கில் பார்த்து டிவியில் பார்த்ததுக்கப்புறம் நான் வந்தே ஆகணும்னு வந்தேன். ஏதோ இதோட எனக்கு நல்லா இருக்கணும். அதுவே எல்லாரும் கடவுள்கிட்ட பிரார்த்தனை பண்ணிக்கோங்க.
Thank you, Dr. Chandrakumar Deshmukh. You have wonderful hands.
She is feeling better while.
Yes, she appreciate you. We all. Any students have any questions? Please raise your hands. We'll hand out the mics. Any questions to Dr. Chandrakumar Deshmukh?
Yes,
Good evening, sir. Thank you for your wonderful session. And last month I attended Vidya Karma and Agni Karma, your disciple Rohit Prabhu. And after that, I am doing in my practice. And anyway, I am getting wonderful results, especially in Sandhigatavada patients. Sandhigatavada and Grithrisi patient.
Yes.
The two patients only, on that day he trained us. And I am doing every day some 30-40 patients, and the wonderful results are coming.
Yes, sir.
And my question is, what is the difference between these points and acupuncture points?
Yes, yes, that is a nice question. Vidya Karma and acupuncture, there is always correlation between them. But Vidya Karma is according to the Marma, Vidya Karma is according to the Dosha, Vidya Karma is according to the Raktava Srotasa. And it is the Siravada Chikitsa. Basically, what happens, if we go for a Guda Basti, then we give Basti till 900, more than 900 ml to the patient, Neuro Basti. But if we go for Uttar Basti, then Srotas is small, then amount of Basti Matra is small. So it depends upon the Srotasa. So Vidya Karma is a part of Rakta Mokshana. If patient is suffering from psoriasis like disease, Sarvagata Vyadhi, then we do Rakta Mokshana directly. There is no need of Vidya Karma in such kind of patients. But Nasagre Vedet, so there will not, we cannot carry out Rakta Moksha 600 ml Rakta Mokshan from the tip of the nose. We cannot carry out Rakta Mokshan from the Vidur Marma Shritam, Ardhavrihi. So it depends upon the Srotasa and the Dushtisthana. So it is related to the Dosha Dhatu Mala Siddhant. And acupuncture is related to the meridian system. There are many books regarding that, but Vidya Karma is 3,000, 4,000 old, and acupuncture is just 200-300 years old. So there is a big difference between them. Energy related, meridian related karmas are acupuncture, and the acupuncture needle is not hollow, it is a solid needle. So there is no space to remove the doshas. So Vidya Karma, every Vidya Karma needle is hollow needle.
So the Vidya Karma is removing the doshas.
Yes, yes.
So in Vada Rakta, Acharya are telling continuously you do the Rakta Mokshana. We are doing the Rakta Mokshana continuously. Whether we need to do Rakta Mokshana or Vidya Karma is enough in Vada Rakta.
No, if you want to remove the Rakta, in such condition, if the Vyadhi is a Gambhir, then we go for Rakta Mokshana. Place is very important. If the place is, in case of Vidya Karma also, If a place is mentioned that you go for Vidyakarma at the site of the 2 anguli above the Kshipra Marma, so if there is a vein, big vein, and you can directly go for Rakta Mokshana because it is Siravad. Siravad means you cut the sira and blood will ooze out, and after the Agristravati Dushtam, it will get stopped by itself. So we are doing the same, we are doing but it is a micro needle, so we are not cutting the vein because there is no vein visible in the Kshipramarma Suparishtat 2 angule. But in some patients, just like in Slipat kind of patient, there is a vein visible. So we directly cut with the help of the surgical blade. We cut that vein and the blood comes, and after that it gets self healed, and patient get the result in the Vataja, Pittaja, Kafaja Shota. So see the place of Vidyakarma. If there is a vein, then go for Siravada. If there is a Avyaktam Asrujam Stravet, there is a no visible vein, there is a no visible sira, then Sukshmam Shastram api Avyaktam Asrujam Stravet. Sukshmam Shastram api Avyaktam, no visible, Avyaktam Asrujam, Rakta Stravet. So Rakta Dushti Sira Vyadhai, Vatva Sira, Pittava Sira, Kapava Sira, Sarvava Sira. If you go with the karma for Vatva Sira, there will be maybe blood or may not be. Pittava Sira maybe, may not be. Kapava Sira, always there is no blood. We have to use cupping like extraction process in such kind of cases. So depends upon the place.
So my last question, because it's very wonderful, the treatment is, sorry. So, see, the Agni Karma and Vidya Karma, you are treating with all the patients. Then, even it is working very fast. Why it was not get familiar these days?
Then I am not getting your
because
question due to echo.
See, this Agni Karma and Vidya Karma working wonderfully.
Yes, yes.
And you and your guru showed to the world. And right now we are doing all the Vasti and Vamana and so many herbals. And why Acharyas goes with all the treatment, then finally come to the Agni Karma, and why they have told initially this Agni Karma and Vidya Karma?
No.
But it is very easy, no?
That is very
Thank
good.
you, Dr. Rajapanti. It's a session. Other guest of speakers are waiting.
Thank you.
We'll take the session on online. We'll be very happy to interact. He traveled all the way from Pune to here for all of us. We'll connect him more. Thank you. Thank you for your interactions. We announce 10,000 rupees cash prize for a student. So you can ask one question. If a student is answering, they deserve 10,000 rupees.
So for 10,000 question, one question is there. Where to do Vidya Karma in Unmadak?
Where to do Vidya Karma in Unmada?
Your time starts now.
Students, two teachers, it's not. Yes, from the 4th row, one student raised the hands. Please, share the mic.
I need textbook reference, that's shlok.
Okay, then it's given to the teachers. I think Dr. Madhumita.
You can try.
It's Bhru Madhya.
No.
Okay, can we give it to Dr. Madhumita and...
Unumada. Charak Sushruta Sharirsthan, chapter name.
Uras.
There is a sequence.
Now the question is open. It deserves 1 lakh rupees is a cash prize.
I will tell the answer. Answer is, so should I tell the answer?
No. If no answer, the praise goes to the teacher.
Okay. So teacher also can tell me. There is a sequence in the Unmada.
Okay, Dr. Deshmukh can give the answer.
Answer is Uro Apang Lalateshu Unmade. Uro Apang Lalateshu Unmade. That is a 3 with the karma. Uro, that is a Uro, Apanga and Lalateshu.
Thank you.
Thank you.
So the cash prize goes to Dr. Chandrakumar Deshmukh.
Thank you for the wonderful session, sir. We were all indeed waiting eagerly for your session, and we are so happy we were able to see it. Now, let us move over to the felicitation. And for that, I would like to call upon Dr. Shreevarma, Dr. Veera Choran, sir, and Dr. Vanita Murali Kumar, ma'am, to felicitate our guest of honor, Dr. Chandrakumar Deshmukh, sir.